registrants, and about 1/3 of those registrants in the room. And so we're going to go ahead and start with introductions to our amazing panelists. And hopefully we'll get everyone in once our questions begin. So I have the really great pleasure of working with each of these women, and you are in for a treat today. First of all, we have Sarah Abrahams, and Sarah is the very long title, Deputy Chief Officer for Prevention and Early Intervention at the Department of Family Protective Services here in Dallas. Harriet Dichter, who is an extraordinary national consultant on early childhood systems. And then we have Kitty Serve, who is one of my amazing colleagues at Text Protects. Kitty is our community alignment specialist, specifically with a focus on universal nurse home visitation and Help Me Grow implementation. And so, ladies, rather than going through and me sharing every word of your extraordinary bios, I'm going to ask you to introduce yourselves and share a little bit more. And then also a question we like to open up all of these sessions with is, what drew you into this work?
I guess I'll start. So thank you for saying my long title so I don't have to, but just to give a little bit of background, while I currently serve as the lead for our prevention and early intervention division at DFPS, I have been working with the state about 8 years around a whole host of family support and intervention services and systems collaboration work. Before that, I spent about 10 years at Casey Family Programs working with that operating foundation. And then before that was sort of in the field working with local nonprofits. I have done grant writing and program development and direct service, and worked for a statewide nonprofit organization working with families and family support and parent leadership. So I feel like I have a few different perspectives. And I think that is part of what drew me into this work, is really being able to work with families directly and wanting to be a part of changing the systems that support them for the better.
That's great. Thank you, Sarah. Harriet, would you like to go next?
Sure. Thank you, Jess. So as Jess mentioned, I currently work doing systems consulting with people all around the country. And that actually gives me a lot of pleasure because I get to work with people in multiple roles in our early childhood systems, people who work in the public sector, people who work as advocates, people who deliver services directly, family members. So that is exciting to me to be able to do that. And I came to this work actually through now many decades of experience serving in leadership roles in the public sector, both in state government as a political appointee and in local government also as a political appointee, by working in the philanthropic community as Sarah did, by working in a local community, actually at My United Way, where I live, and by having a variety of experiences actually with the very people that I now serve. In terms of how I came to have this focus on systems, in some ways it's straightforward. I am trained as a lawyer, and I actually started, after I finished law school, my work as a legal services lawyer, providing services directly to extremely low income families, mostly women, in the community. And one of the things I saw very quickly as I was doing all the work was that I was really interested in upstream solutions, and that I loved every jewel of a problem that I was helping people to solve in my lawyering role. But I was pretty convinced that there were other ways for me to be able to make a contribution. And I was very active in my home community on maternal and child health issues and racial disparities on infant mortality. And that opened other pathways for me. So I made a transition from my direct work into this kind of systems building work that has engaged me ever since. Thank you, Jess.
Thank you, Harriet. And I too have had a similar journey of really being drawn to the work with individuals and families to getting to a place where I wanted to be a part of systems change. So we're really excited to have you on today. And then last, my amazing colleague, Kitty, I'm going to have you share just a bit more about yourself and what drew you to the work.
Thank you, Jess, and hi, Harriet and Sarah. Good afternoon, everyone. After listening to both of you, I'm like, where should I begin? So mine is also a transitional role. I was a global HR manager for the longest time, and I lived in Africa, Europe, Asia before I came to US. And what I noticed in my journey in those years is that racial and culturally minority groups had these disparities in healthcare, in access to services. And I think that is what drove me to this, acknowledging it finally and wanting to make a difference, at least get involved in some way. And so I left my job there and came to Text Products, the perfect launching ground for me. And since I'm an immigrant, a mom, I understand how crucial these intersectionalities are. And hopefully I'll do something worthwhile here while I'm here. Thank you.
Well, you already are. We're so blessed. And personally, I'm so blessed. I've already learned so much from you. So we are going to jump in. Everyone, if you have questions that come up during our discussion, please go ahead and put them into the Q&A function. I'm going to try to monitor that. We also have staff from Text for Text that will help me monitor that. And then note that I will prioritize leaving about 10 minutes at the end of the call for any additional questions that may have surfaced. So let's dive in. My first question for all of you is, we're at this really interesting time where we're seeing more and more families in crisis and having really significant needs. And we have had an influx of funding, specifically for Texas, but in states across the country, an influx of funding that has come through in connection to federal aid. What I would love to hear from each of you, Harriet at the national level, Sarah at the state level, and then Kitty at the local level, is what are the innovative strategies that you are seeing in the community, or that each of your entities is operating in order to really capitalize on this moment and on this funding. Yes, Harriet.
Do you want me to kick it off? Okay. So one of the things I wanted to do to help us kick off this conversation is to make sure that all of us who are participating in today's call actually understand how the federal relief money is widely available, who is getting it, and how our topic for today relates to those resources. And so let me start by making sure that all of us share together that there is one fund. There are multiple federal relief funds, but there's one fund I really want to highlight because it has really broad application and potential use. And it may provide a journey for people who are listening in from anywhere in the state, besides what I think Sarah will talk about in terms of state agency. So through the last round of federal relief money, there was something set up called the state and local fiscal recovery funds. And these funds go to states and the District of Columbia, but they also go to counties and metropolitan cities and something called non-entitlement units or smaller local governments. This money is distributed directly by the US Treasury to each of these entities. These are entitlement funds for each of them. And the US Treasury, who's in charge of this, has done an incredible job of holding up the importance around services that speak to the root cause issues that we're talking about today. So we know that in addition to what the state is getting, local government is getting resources. So that's the who. is getting these resources. I want to share for a minute what is that Treasury has said are allowable uses, because this is very important to the innovation, the creative thinking, the work that lies in front of us and may already be going on in some of the communities that people are from. The resources can be used to be able to deal with negative economic impacts from the pandemic. What does that mean? That means we can have assistance to households and communities, assistance to small businesses and the nonprofit sector, aid to impacted industries, uses in the public sector and their workforce. The types of services that are being called out that are very relevant to our conversation are things such as cash assistance to families, food assistance, child nutrition, food banks, basic issues of food insecurity, early childhood services, specifically called out childcare, early learning services. I want people to listen carefully here, home visiting programs, services for child welfare involve families, foster youth, and the facilities that house them. Programs or services that support long-term housing security, including the development of affordable housing and permanent or supportive housing. And within that, these can be new services, they can be expansions of existing services. They can be focused on increasing access to these services. And in fact, within these funds, there is capital involved, so that if facilities or improvement of facilities is an issue, these can also be addressed. Another example that's also going to be relevant as we talk about best practices and what our root causes really are, includes people who can assist people with navigation, outreach, and marketing efforts. So it's a generous view. And one of the things that I and others have found so heartening around this set of funds is that the federal government, in being explicit in the guidance, not just to states, but to local government too, has spent a lot of time and energy in calling out how much of what we would consider a prevention agenda can be addressed through the use of these funds. The last point I want to make as we set this up is it feels like maybe a bit ago that the federal government made these monies available. So you might ask, are all these decisions made? Well, here's the answer. Each unit of government that is receiving these funds under this big umbrella here has to state or obligate the funds by December 31st, 2024. I just want to say that one more time. They must obligate the funds by December 31st, 2024. They need to be expended by December 31st, 2026. So not all these funds have been obligated everywhere. There is still plenty of opportunity, but I think this is an important frame for us because it is unusual as we are talking about these types of services to actually have this broad-based opportunity, not only where the state may get specific categorical funds, but also where local government is getting broad-based funding that can be responsive to how community is thinking, talking, and needing to have their needs met. So that's enough for me by way of what's out there, okay? And what's out there that you might not realize is in your home community that perhaps you can get engaged in to try to bring into the kinds of services we're discussing today.
That's really great, Harriet. And Sarah's, of course, going to share information about how some of those funds are flowing through her department. And when you, I just want to clarify, thinking of questions that our audience may have. So when you were talking about funding within the communities, you were talking about funding that has been distributed to state and county government?
Yes, and cities.
And cities.
Cities
yes.
as well. And
Okay.
I've actually given Maggie for people who really want to go into the links, they're now posted, I think, in the chat. And so these are links to the guidance from Treasury. And if you open them, you will be able to see more specifically the specific recipients. But I want to be very clear that these are resources that go to county government. And there are also resources that go to cities, larger cities, what the census calls metropolitan cities. And there are some smaller units of government as well that are able to are getting these resources. And they are entitlements. They are direct funding from the US Treasury to these forms of government for their use and redistribution.
Thank you. Thank you for that clarification. And so for our participants that have joined and for those that registered but maybe were unable to join, we will be sending those links out so that all of our participants can have the information. And so Sarah, I'm going to now go to you and, to build off of this foundation that Harriet has laid that paints a national picture of how funding has been disseminated. Can you talk to us about specifically the Department of Family Protective Services and Prevention and Early Intervention?
Yeah, absolutely. And so I'll share that we have been thrilled and excited about some of the ARPA related dollars that we've been able to use and disseminate. And the primary sources for PEI and DFPS around prevention dollars connected to these kind of recovery efforts have been in the community-based child abuse prevention grant, so the CBCAP, our maternal infant early childhood home visiting grant, McV, and then we've also gotten some amount of funding through TANF that has been specifically aimed at providing basic needs support to families directly. Mm-hmm. And I will say, in terms of the way that we have concentrated on using those dollars, I think it's really been a reflection of a few shifts that we've seen in prevention services in general, and in really focusing on a continuum of services and a prioritization of really meeting families where they are and addressing the specific needs of families that they are bringing to the table. And so I think when I first came on board in our home visiting and early childhood world specifically, but really in terms of parent education and family support, there is and remains a real focus on evidence-based, evidence-informed direct services, a program that we would make accessible or available to families voluntarily in the community. And I think there's a real need to continue to provide those kinds of quality programs. But what we hear from families and from communities is that that by itself is not enough. And that we both need to be focusing on the systems work, the sort of collaborative work, both to streamline things like just knowledge, referrals, navigation, some of the things that Kitty mentioned in her introduction, and also these kinds of services or service delivery methodologies that aren't really program-based, but are really more about having resources available in the ways that families might access them more readily, or in phases, or sort of as they need them, rather than an already packaged set of existing resources. And so when we looked to invest the additional dollars that we received, we really focused it in these three categories. One was on basic needs and crisis support work for families. So that is really like concrete support, help with rent, help with utilities, help with getting a car fixed, grocery cards, diapers, formula, although that is probably another part of this conversation. We also expanded some access and availability of some of the evidence-informed, evidence-based services that were existing in communities, but where we saw significant need. And then we invested some amount of money in a handful of sites, 7 in particular across the state, to implement family resource centers. We've used some, not ARPA dollars, but some of our FFTA or Families First dollars to help pilot and evaluate some kinship navigator programs. So programs that are specifically focused on helping kinship families sort out all the resources that they may need to take care of family members that are not their biological kiddos. And then we've also invested in this series of what we're calling innovations or innovation grants, which have also really specifically focused on things like parent voice, parent leadership, parent engagement, really authentic family and parent partnerships. So thinking more creatively and investing in communities to think more creatively about how to bring parents to the table in every stage of our planning and delivery and evaluation of services. We've also invested in thinking more explicitly about diversity, equity, and inclusion in these communities. And that is everything from really examining our organizational structures and policies to beginning to look at data by race and ethnicity, to thinking about how are we addressing cultural humility and cultural differences in all of the programming that we offer. And I will say, finally, the other way that we have been investing these recovery dollars and working with communities to invest these recovery dollars is really in frontline worker retention and salary support, especially for our home visitors and frontline staff that are working directly with families during these very difficult times.
I so appreciate that, Sarah. And we're going to talk about some of the disparities that we see in maternal and child outcomes shortly. One thing that came up for me while you were talking, when you were talking about the family resource centers and really engaging parents at every level from planning through implementation and evaluation. I'm curious, as you continue to, walk on that journey, what are some of the ahas that you've had?
Well, I mean, I can say it has been extremely humbling to work alongside parents, and we have now implemented several initiatives, both at the state level and at the local level, where we have parents working alongside us in implementation. And I think one of the ahas to me has been how it has really forced us to be more clear and communicative at every stage. And I think sometimes we don't even realize how moving so quickly means that we haven't addressed every issue, or we haven't thought about it from every angle. We're just pushing through to solutions so quickly. And the parents at the table with us really have forced us to slow down, to explain ourselves really in a way that maybe we wouldn't have thought to do otherwise. And I think our programs have been richer for it. And then I think the other thing that I'll say, in our prevention world, which I know is not true in every family service field, families are coming to us voluntarily. And at PEI in particular, it's written into our agreements with local providers that the services must be provided to families voluntarily. And when especially during COVID, during some of the height of the pandemic, when we were struggling to have families continue with some of our more traditional services, I think that was also a real aha, because in some ways parents don't need to tell us always with their words what it is that they need. They can tell us by not coming to the voluntary programs that we've provided. And I do think there is a little bit of market push and pull as we consider what do families want alongside what we have to provide, and trying to better bridge that gap between what families would identify that they need, what would help reduce their stress level, what would help them feel more competent, what would help them navigate their own worlds better, instead of us sort of creating the solutions and bringing them to them. And I think those two ahas have really been game changing, both for us at the state level, but also in the way that we can support local communities.
Thank you so much. I mean, I'm thinking for myself, I'm really grateful for that also moment of empathy of, I feel certain everyone on the call today got into this work because they're passionate about the work. They want to make a difference. And there's so much dire need that sometimes those moments of taking a breath and reflecting and not just gathering feedback, but building partnerships, that takes time.
Yeah.
But you're right, it is the secret sauce in terms of getting to sustainable, programs and interventions that are really going to benefit communities. So thank you so much. I'm sure that others feel the same way hearing you share that. And so I am going to now look to Kitty. And so Kitty, we've heard a lot about federal and state level funding and infrastructure and programs, but you are on the ground every day working with families, specifically here in North Texas. I wanted to see if you could share your, just a bit about your experiences of meeting families where they are and some of the aha moments that you've had yourself.
I'll first resonate with Sarah that it has been a humbling journey. I cannot tell you how much it has transformed me as a person. And I have started seeing the world from the lens of the family. I'm trying to elevate the family voices, listen to them rather than talk to them. And I am so intentional these days on the words that I use to communicate. I replay it in my mind before I speak. It is hard. It's a hard thing to do, but I have learned to do that. So locally, I support this universal home visiting program, and I can provide wonderful illustrations of how effective these programs have been for the families with a newborn child. The program is designed in such a way to increase the family's well-being by bridging the gap between the needs of the family and the community resources. And it's a universal program. So due to its universal approach, we have served a diverse group of moms. We have served lawyers, we have served ER nurses, we have even served physicians. And each of these visits is as unique as the mom themselves. So I'll tell you two very different visits that we had. The very first visit, one of the very first visits we had was a young Afghani refugee mom. And she was alone, very young. The husband was back home and she had no job and needed a lot of help with resources, connections, cultural, connections and all that. But that's not the case with every family. Recently, we served a mom who was a prominent lawyer here in Dallas. And she initially refused our service. She said, okay, I'm good, everything is good. And 3 weeks postpartum, we received a call from her husband. He said, can you please come visit her? She's struggling with the challenges of being a new mom, and and she's like spiraling into depression. And the nurse immediately, she's like, okay, let me go meet her. And that 2.5 hours, all the mom did was talk. She's like, I had my life planned out. I thought this is how it is going to be. The baby is going to sleep at X time, eat at X. Like she had it planned out. It was not panning out. And she was going into depression. And after the visit, when the nurse was coming off, she just hugged the nurse. She said, I think it's okay if I hug you. Thank you so much for coming. Like, this is what I needed today. I needed somebody who would just listen to me, who would understand my struggles. So you can see both these visits were so different. One had so many needs, needed resource connection. One didn't need any resource connection, just that support. So whether you're a first-time mom, fifth-time mom, working mom, you're just a mom, and we could all use that support. And when it is given to you in the comfort of your own home, that is all the better, right? I was once a mom not so long ago, and I would have given anything to have a home visiting program like this offered to me. So that's my take on home visiting. As it is needed right now, it is needed.
Mm-hmm. That's really beautiful, Kitty. And I said the same thing when I learned about this program. I would have loved to have a nurse come to my house 15 years ago when I brought home Jolie, my first child. I really love, the way that you tell those stories, because it's about connectedness. And, sometimes we think about these things as very soft, soft skills, the fluffy things. But I want to point out that the CDC has identified connectedness, social cohesion, as actually a protective factor against child maltreatment and other, other things that lead to poor outcomes for children. So thank you for being our angel of connectedness. And the program that you talked about is really beautiful. I love, we can talk more, but when we're talking about innovation, I'm a public health practitioner, so I lean towards universal interventions that provide the right amount of services for the right family where they are. So we're going to shift a bit and talk about disparities. And so, Sarah, I was really grateful that you talked about, I believe PEI is one of the national leaders in terms of how you all are working to address racial equity and to really understand why disparities exist and continue to persist. And so I would love if you would share a little bit more. I'd love to hear from each of you some of the things that you are encountering in this space when looking at disparities, as well as, some of the things that you are really enthusiastic about and you're looking forward to innovative strategies. And we'll start with you, Sarah.
Thank you. I'm happy. I would say there are two things that I think PEI is really focused on right now in terms of thinking about equity and addressing disparities. And I think one of them is really connected to our focus on parent voice and parent partnership. I just don't think you can untangle those things. And I think you can't address one without addressing the other. And so I really feel very strongly that our work around inclusion and parent partnership and parent voice is a critical component of our strategies around thinking about and taking action around disparity issues. I will say the other thing that PEI has really actively done over the past year to 18 months is begin really for the first time to break our data out by race and ethnicity. I know that feels at this point like it should be a duh, aha moment, but it just, in part because prevention data has been so hard to come by, and just getting it all in one place felt like a monumental achievement for us. And I hope that some of our audience and some of you guys on our panel have seen our maltreatment maps, which are publicly available, and part of the way that we think about community vulnerability and potential drivers for maltreatment. But beginning to break that work up by race and ethnicity, along with really looking at who are we serving in communities through our prevention and early intervention programs, through home visiting, through family connects, through family resource centers, and breaking that up by race and ethnicity. And right now we're really focused on just how are people coming in the front door? Who is coming in the front door? How are they being referred? What does that mean for what kind of, does the combination of the referral source and someone's race and ethnicity determine the journey that they might take through these kinds of services? And what does that mean and look like? We have been working with Casey Family Programs to do a deep dive into, we chose 6 communities, just both based on geographic diversity and the data that we were looking at, and began to dive into those local communities by race and ethnicity, and really meeting with communities, community providers, referral sources to share that data back with them and begin having conversations about, what does this mean? Why do you think this looks this way? Does this seem like what you're experiencing on the ground? Does this resonate? Does this look wrong? And we're also meeting with parents to share this data with the community to say, what do you think this means? Why do you think this, as a parent, how does this match your experience? Did you know anything about these programs? How would you have wanted to be referred? So we're really using that data as foundational in the kinds of conversations we're having at both the state and local level around this issue of disparity. And also really, and again, I think that you cannot untie that from the way that parents feel and what they feel like they need and want in any of these kinds of systems. Parents will tell you quite clearly what it is that they think they need and want for their families. And they will also explain to you why what you are giving them is not what they what they need or want. And I think it's that communication and partnership that is going to help us pull our prevention services into the next phase of outcomes and responsiveness to families. So
Thank you so much. And we would love to share out those maps. So when we follow up with participants, would be grateful to do that. And I don't know if you can share, I know that you're in the process of having these conversations, but when you're talking with communities about over the questions, does this make sense? And we're here to talk about root issues and what does the community say back in terms of, what the data is showing. Are there any nuggets that you can share with the audience today?
well, I
And
think
forgive me, Sarah needs to forgive me because I'm totally putting her on the spot.
No, it's fine. So we are only partially the way through this exercise. So I can share a little, I will share, there are lots of surprises, like there's a lot of feeling of surprise to look at the data in this way. I think it's not always been very common to look at the data in this way and talk about it from this perspective. I think one of the things that we've been able to measure, at least in our system, and I know this is not true in every system, but through PEI, one of the things that we ask clients for or providers to address as a part of their intake process is just what might be some presenting characteristics of the families that are sort of voluntarily enrolling in these services. And even those priority characteristics differ quite a bit by race and ethnicity. And part of what we're starting to drill down into is that because the priority characteristics that the families feel like their priority characteristics are different, or because they're being defined differently by the intake taker or the provider, and how do we connect those? In some ways that's an assessment problem or a problem perception problem in terms of what the families feel like is the problem and what providers or the intake counselor might see as the presenting challenge. And so I think that kind of information just helps us build a better system.
Thank you for that response, and thank you even more for the work. I do want everyone to know that the link to the maps has been dropped into the chat function. We will certainly still send it out to you all after this, but I'm going to go ahead and turn it over to you, Harriet. Now, I'd love to ask the same question, except on the national level. What are you seeing that is innovative that you're really excited about? And just because this question would come to you, there was a question that was dropped into the chat in regards to the funding opportunities you shared about, Harriet, and it's if there is funding available through the funding you referenced to start birth parent programs in Texas.
Okay, thank you, Jess. So let me start by saying that there are a lot of exciting things happening basically around the country that are having a focus on dealing with issues of inequity within our frame of addressing root causes and really using a primary prevention framework, which is what we're talking about. And I think what I might say is these are community driven, they're community based, they're really trying to be specific and intentional around who's designing, who's engaging, and how are all the parts fitting together. And I want to offer some specific examples. I have way too many, Jess, because I actually have 8 different types of examples. We're not going to get through all those today, so I'm going to take a few, all right, to share with people.
You're just very well prepared.
Right. So let me start with the first one that some may have heard of. It's the baby bundle in Bridgeport, Connecticut. Now, Bridgeport basically developed this initiative with equity in mind. The focus is on the families and community, from a economic, racial, educational, and health inequity perspective. The idea here is in some ways simple. It's really to say it's not once and done. It's not a single service. It's a bundle of opportunities of services for families. Sarah talked about some of these frames. Supports for caregivers. That's through services such as home visiting or parent supports. One of the things I like best about some of their parent support initiatives is they have a whole music one for families and children together, all right, as a way of actually building up parent confidence, parent competence. Data system work. Anyone who's professional in this field knows this is a big problem. They put their minds in this collective impact initiative to do that. Doulas. So moms, right, really critical. A 0 to 3 focus, starting where it all starts. And within this concept of the baby bundle, the bundle is there for you, but it's not required. It's really navigation and supports to be able to assess. So this is an enormously exciting initiative because of its comprehensive nature and because it is so community driven. Let me move on just for a minute. I'm going to offer a couple more of them. I think we've talked some more about this, which is the concept of navigation supports. All right, that, and I think Kitty actually already has illustrated a little bit of that in her work. But in Michigan, really focusing from a race equity perspective in the city of Detroit, there is peer-driven assistance and navigation assistance now within this strong racial equity focus that is helping people to get places where they want to go. What does that mean? That means people are getting assistance with housing issues, with mental health issues, with health issues. So pretty critical issue here. Another example of this, which I think is really interesting, is actually in Guilford County in North Carolina. Their strategy is to actually think about the developmental trajectory of families with young children. And so they're really focusing on points and times in which they are proactively and conscientiously conducting outreach and trying to provide support. So that's some of the things that we know about during pregnancy, when a baby first comes home, in the postpartum period, but also thinking about milestones, a baby's first birthday, a second birthday, a third birthday, a continuity of support that is not just our doors are open, something that we embrace in many of the programming, we're here for you, but strategic considerations about how the outreach is occurring so that it's not just we're here for you, but an effort to go for the whole population. So that's another one I wanted to share. I think that's really exciting. And then the last one I just wanted to mention, well, I have two more that I want to mention briefly. So home visiting, that is of course a really critical strategy, but innovations in home visiting. So one innovation in home visiting, and the example I want to call out is from Colorado, is actually in Latinx communities in Colorado's applying known home visiting models. In this instance, parents as teachers basically is one of the models, and a second model as well, with home-based childcare providers. Now, that's a lot of work because there are different connections being made, but it's flipping a little bit of this strategy in terms of other environments where young children are in with other caregivers. So that's another one. And the last one I just have to mention is a model that actually grew up originally in the city of Boston and grew out of health clinics. And that model, which is now called Developmental Understanding and Legal Collaboration for Everyone, is locating family specialists within primary care clinics for women and children. And having these specialists have complex teams, and those teams include not only the medical personnel, but also lawyers as well as mental health system specialists and early childhood system specialists. Those strategies are really trying to address this full spectrum we've talked about. Sarah talked about this concrete supports to building a community around you, basically to having access to other services. And I want to give one concrete example before I stop talking. I could go on, I have many more examples to share in here, that one of the things from this initiative that has done very well was actually being able to identify high levels of maternal depression. We know that exists, but doing something about this is really critical. And so not only being able to identify women with maternal depression, but being successful in getting supports, okay? Because that's where the rubber meets the road. It's not just knowing our problems, it's really strategies that actually people feel are about them. And so I think those are commonalities in terms of addressing disparities in all of these things that I've just mentioned. So I'll stop for now. I want to answer the other question, which is, while I can't comment exactly precisely on the question of that specific program, I do want to say that the federal funds that I referenced, this big general relief fund, where there are state, as Sarah talked about, Sarah talked about specific appropriations that have gone to the state for prevention activities and maternal and child health. Within the buckets that I was referencing, these general funds, there is broad flexibility. There is broad flexibility here and an opportunity basically for creative thinking. This wasn't the federal government saying, let's tell you all what to do. This was the federal government devolving resources so locals could make good decisions about the needs in their community.
Thank you so much. I was taking notes while you were speaking, and now everyone knows why I love Harriet so much, because she has such a stunning wealth of information, which is probably why she's a systems consultant. But what I noted when you and Sarah were talking is, I'm really pleased that we talked about home visiting programs. Of course, Text for Text is a huge advocate for such programs, but we're talking about the root issues. So we've talked about the need for enhanced and readily available behavioral health care, medical care, the need for stable housing, for critical basic needs, and for developmentally appropriate support. And so, the developmentally appropriate support is another, really important either protective factor or risk factor when it comes to child abuse, making sure that parents understand what is appropriate at each marker. So I love that. I love that we are talking about all of these. And Harriet, we will make sure and get the list of specific programs that you highlighted so that we can share that out. Kitty, I'm now looking to you. And what came up for me when Harriet was talking was you have worked already with a pretty diverse range of mothers, and thought that maybe you could share some of your experiences, but also the program that you spend the majority of your time on, which is a universal nurse home visitation program, has a very specific focus on mental health. And so how you have, if you could also share how you've experienced the critical need for that from moms that are sitting in front of you.
First, I will start with telling that for families, immigrant, refugees, moms who come, I met some of the organizations who talked about moms from Congo, from Rohingya immigrant moms who have experienced so much trauma prior to coming here. And then they do not know the system, they don't know the language. So it is so critical that we offer services that are culturally and linguistically appropriate. When a mom goes or we refer her to it is intimidating for her to make that call. So we need to be really sensitive about these things. And when they make that call, making that one call is hard. And making multiple calls to get connected to multiple services is daunting for them. Honestly, it is. I have sat with these moms so many times and helped them make those calls. I'm like, you make the call. If you stumble, I'll take the phone from you, but make it. So I'm a huge advocate for that centralized one system where you can make that call and in one go get connected, one stop. And I think Help Me Grow is a perfect example where we have so many resources under one roof. You call, then they will identify, okay, you need this, and connect them to those multiple, and then loop back and ensure that you're connected. You're not like left in a limbo. Okay, this is the number, call. It's not like that. They need that support for a while until they get assimilated into all these things. And while I was talking to this one, they said these moms, some of them, I'll just say it out here, the moms from Congo, they have been raped multiple times. So imagine the trauma they are bringing with them. So it is important that mental health support is so critical to our program. We need to, there are so many agencies here locally that are doing amazing work, and I want to give a shout out to them. Culturally, linguistically, they have aligned, regrouped, and done some such great work. So shout out to all of them. And recently, I'll take just 2 more minutes. I know you're on time. I met this intern at UT Southwestern. She is Arab American, and she said, where do I fit in? And she's going to be a doctor. I mean, she's an intern there. And she said, where do I fit in? I'm white, but my health challenges are not white. My, where am I fitting in your studies? Where am I in your data? And it brought in an interesting point for me, is that when we are talking culturally inclusive, we need to probably, again, like Sarah said, like be mindful of changing bring about that change of including subcultures or things of that kind. So
I think that's an excellent point about inclusion and shifting the narrative, which they're
sorry, we are all doing this with good intent. Now we have to see the impact of what we are doing. We are there.
Yes. Yeah. Thank you so much, Kitty. I'm going to make sure I haven't seen any additional questions in the chat function, but I want to make sure and remind everyone we have about 8 minutes left. And so if you have questions, please drop them into the Q&A section at the bottom of your screen. I will be sure to look out for that. I want to make sure and save a minute or two to talk about connecting with Text for Text. But I'm wondering, Harriet, Kitty, or Sarah, if there's a question that we didn't ask, or if there's anything else that comes to your mind hearing one another share that you would like to offer before we end the call.
I think I would just like to say I'm appreciative of the ways in which Sarah is describing both the breadth of understanding, basically, and efforts that the state is going to, but also the willingness to get in there and start to change practice, because those are really hard things to do. And going from being the experts, the professionalized staff, to partnering and really changing maybe who's in the driver's seat, Sarah, in terms of the programming, is really important in terms of doing the right thing, but it's not necessarily so easy to do. And so I just wanted to hold that up. Basically, the other thing that I think maybe we should be talking more about, it's come up a little bit today, but we started by talking about how so much of this work on root causes is driven by models that are evidentiary based. And at the same time, one of the things that has been happening and started, I think everyone has seen this around the country during the pandemic, people had to adjust, and model-driven programs couldn't be so model-driven anymore. Okay, and families became more forthright around saying, I like this, I don't like this, I can't do this. Sarah talked about that, voting with your feet a little bit. And so I do think that this is another important conversation for us to be having, is how we're balancing basically often what is the quest for us to get public dollars invested. We have to prove that it works, with also some of these opportunities for innovation. And really, as we were saying to families, you're in the driver's seat in terms of how we're going to proceed. then those are challenging questions, basically. So this raised that up for me again, that we need to keep talking about this. And, thinking about what does that mean, again, to drive investment, public investment into the work, but also what this means as we're shifting and centering the power and decision-making, basically with families and community in an equitable manner. How do we balance all of this? Sarah, maybe you want to say more on that.
Well, no, I mean, thank you for what you've shared, and I agree, obviously. I think the only thing that I would add is that I just don't think we can overstate how stressed and overwhelmed families feel right now. That I think there is a bit of a sense that our pandemic crisis is ending, and so we can get back to normal. And what we see and hear from families directly in every community across the state is just this sense of exhaustion, of feeling overwhelmed, of needing more support maybe than they needed in the past, and not being able to juggle all the things because our systems aren't streamlined or aren't in tune to being able to meet multiple needs at once. We often put the onus of that on these already stressed out and overwhelmed parents to figure out how to juggle and manage all the kinds of supports we want to offer them. And I think, to Kitty's point, there is a lot of good intention out there, but I think I just think this is part of having parent voice at the table, is that what we're hearing them say is, please slow down, listen to me, help me figure this out. Across the board, there is just this sense of exhaustion and stress that we have to talk about and take into account as we're thinking about how to help families. And that's true for the families we're serving, but it is also true for our staff and the folks that are working directly with these families and communities. And we just have to be talking about those two things as at the same time that we're talking about systems change.
I'm so glad that you brought that up. It was something that I was going to bring up. And I guess my guess is it'll come up every session during our series, is that our employees, I say this all the time, are human first and employees second. And it goes back to what we were talking about earlier, Sarah, about taking the pause. As leaders, we have really a critical responsibility right now to take a pause and make sure that our staff are doing okay, and make sure that we are supporting them as whole individuals, as whole humans. So I'm really grateful that you brought that up. There was a question that came in that Harriet, I see, is typing an answer to. There's an additional question that I'm going to read. This is not just the families we serve, also our staff are overstressed. And I'll go ahead and finish to make sure, in dealing with the same issues that our families are facing. What can we do for our staff, because we provide them with what we provide to the families? We are losing staff because they are going through the same issues, and financially we can't support them. So we have 1 minute. But I'll offer that this is a conversation that I would personally be happy to have offline, and even to connect to our panelists. I think it is probably the most important issue that we face right now as leaders, is how do we pour into our families? And then in regards to what providers are able to pay families, this is why it is so important to support policy modification to ensure that salaries have a livable wage for these critical positions. And so on that note, just as we wrap up, I want to make sure that everyone knows that we want to connect with you. We're so glad that all of you took the time to be here today. Our mission is to educate and advocate to ensure that children and families can thrive. And so on the advocate piece, we really encourage you to connect with us on a deeper level. So if you go to our website, www.textprotects.org, you'll see a way to get connected and to sign up for our advocacy alerts and newsletters. we are on the heels of the next legislative session. It will be here before we know it, and we are already working to identify champions for our priority areas, and we really do need your support. If you connect with us this way, we will make it very easy for you by sending you quick links so that you can get in touch with your policymakers and make sure that they know that for you, their constituent, these issues are important. So please take the time and do that. And we hope you can join us for future sessions on this series. And I just wish you could join me in giving a round of applause for our amazing panelists. Sarah, Harriet, and Kitty, thank you so much for being with us today. Everyone have a beautiful afternoon.